Hello. The purpose of this talk is to introduce the watcher to facial aging. This talk will be broken down into two sub-talks. The first talk is going to discuss the structural changes that occur with facial aging, and part two of the facial aging talk will talk about the skin and the superficial skin. With respect to the structural changes of aging, there are numerous factors that control the aging process. First, there's genetics. You can take a look at your grandparents and your parents and have some degree in terms of how you're going to age over time. There are also other factors such as nutrition, environmental exposures, how much sun exposure, whether the person smokes, overall general medical health. All of these factors come together to create a complex schema to how an individual ages. Despite these things, there are certain characteristics that we can universally see with people as they age. First and foremost, what we can see is some of the tissues start losing their elasticity and start sagging. This can be due to multiple different things. Number one, scientific studies have shown that there is some amount of bony volume loss as we age, so the skull actually becomes a little smaller. Number two, all of these tissues are suspended to the skull with ligaments and tendons and all these various soft tissue structures. These soft tissue structures over time do lose some of their elasticity, and therefore these tissues tend to drop. Also, within the neck, where you have gravity also pulling down as well as weight changes over the course of one's life, you can see laxity in this region as well. So the main areas you see laxity are the dropping of the fat pad right here, which causes a fullness in this region, loss of volume across here, and skeletonization of the orbital rim, loss of definition along the jawline where the tissue comes over, and you can see the smile line here, as well as jowl formation, laxity along the neck region with loss of elasticity, excess tissue, and possible even fat herniation in this region. These are the main structural changes one can see with facial aging.